welcome everybody. Thank you for coming. So I'm delighted to welcome RSS fellows, visitors to what this is the DeMO meetings, the pre-meeting for the discussion meeting to take place at 4 p.m. today, discussing the paper A System of Population Estimates Compiled from Administrative Data Only by John Dunn and Li-Chun Zhang, who are with us today and will be presenting later. And actually, John will later be presenting in this pre-meeting, this DeMO, which means discussion meetings overview, in the second part. And I'll shortly introduce the speaker for the first part, but just a few announcements. So we also welcome an online audience doing hybrid meetings now for all pre-meetings and discussion meetings. If you're online, we ask that you keep your microphone muted and camera turned off, unless you're called to speak at any point during this session or the next. A recording of this meeting and the discussion meeting will be posted on the RSS YouTube channel. So please let us know if you prefer not to be filmed so we can edit that part out. And then anyone joining online who experiences technical problems should use the support chat box and wait for someone in our support team to help you. And I've also asked both speakers who are happy to take questions during the presentations in this session. In the discussion meeting, we're a bit more formal and everyone speaks at the end and we call them up. But here we can be more interactive and have a chat as well. I think both speakers said they were happy with that. And just a final thing to note, I don't want to take up more time, there's no planned fire alarm test. So if there is a fire alarm, it's real, and please evacuate. RSS staff will help, and basically don't all rush to the nearest exit. There's one at the back, and there's where you came in as well. So they're both fire exits, and we meet just there in the fresh air if that happens. So without further ado, very grateful. It's great to actually have, I think, a speaker who's not one of the authors present in the DeMO, because I think that brings a healthy, different perspective. So we're absolutely delighted to have that this time. And Ellen Law, who's a principal statistical methodologist at the Office for National Statistics, will be giving us an ONS perspective on population estimation using administrative data. Thank you so much, Ellen, for joining us today.
Great, thanks very much, and thanks for the invitation to come and join in this session. It's really good to get an opportunity to talk about the work that we've been doing and our plans for the next 6 months, who knows, a few years. So I'm part of the team in the Methodology and Quality Directorate at ONS, and we're working on this problem of population estimation, working from administrative data, but complemented by other sources. And I'm going to discuss some of the different approaches that we've been thinking about. And this is in a wider context of many countries that are trying to solve a similar problem. And so we'll make some comparisons to how other countries are going about it, and bring in Ireland's work as well. So let's see if the mouse works. Nice. Okay. So to start off, I just want to give a quick plug of the consultation, which is starting on this Thursday, the 29th of June. This is about our population estimation work feeds into this, but it's much wider, and it's about the future of all of these statistics. So just quickly, this is about an exciting proposal to provide more frequent statistics that really are at a sustained level of quality, which will replace what we've had with the census, where we have an extremely detailed picture every 10 years. And now we're looking to put forward a system that will fill in those gaps and that will provide all sorts of other things in the years between those. So we have population migration statistics at the heart of it. That feeds not only into population things and resource planning, but also into economic statistics. There are multivariate characteristics to reflect the diversity of different groups in local areas. Statistics about housing and the groups of people that make up households. And then outcomes and the longitudinal analysis that we'll be able to do with some of the new things that are part of this transformed system. So this proposed system should be responsive to changing needs and changing data landscape. And it's really important that we hear from everyone who's interested, and anyone who has any user needs, anyone who has any expertise in the area. So please do get in touch and feedback into the consultation. So the timeline is that it will go live this week, and then it will stay open until the 26th of October. And there is an email address to contact if you would like to. So on to the main bit of the talk. So we are in this transformed population estimation system. The part which we'll discuss today about producing population stock estimates is just one component of that. And the bigger picture looks like this in a very simplified way, with a dynamic population model at the center of it to reconcile and make coherent a number of different sources. All of these different flow measures, birth, deaths, migration, which are then combined together in a demographic accounting model with a formal statistical structure so that we can take into account uncertainty in those individual inputs and produce coherent estimates as the output. So one of the most important inputs into that dynamic population model is the population stock estimates, which we need broken down to the level that the dynamic population model will need to estimate. So those population stocks will be produced by some kind of coverage estimation process, which will take a combination of administrative lists and potentially some kinds of surveys. And the different options that we have there is what I'm going to go in more detail on. But we have different opportunities to use different kinds of administrative lists. When I use the letters SPD, I'm talking about a statistical population data set, which is a way of combining together a number of those lists already using some rules. So this is the three main high-level options that we have been trying to work out how they could be put into practice. So the aim of any of these options will be to produce some population stock estimates that are as unbiased as possible. And they will be feeding into the dynamic population model. They'll be adjusting for any coverage problems in any of those individual source data sets. Our first option is suitable for the kind of statistical population data set that we're working with at the moment. That SPD has both undercoverage, people who should have been included but are not. For whatever reason, they're not interacting with the services that cause someone to be on the list. Or we also have overcoverage, people who have been interacting with the services but actually are not usually resident in England and Wales. So if we have an SPD like the one that we are currently using, we will need to estimate both the overcoverage and the undercoverage. And the best way to do that would be to run a survey that's specifically designed to do each of those things. We can sample areas and then find all of the residences there and find out how many people live there to estimate the undercoverage, and conversely with the overcoverage, we can sample from our list and find out how many of those people are actually in our usually resident population. Option 2 would be suitable in a situation where we have a different kind of statistical population data set. In the case of A, where we just have one survey that's designed for measuring overcoverage, that's because we've been able to reduce undercoverage to a negligible level. So we would have to do all that we can to compile as many different administrative lists as possible to eliminate that undercoverage as much as we can. In the other example, where we would just use one survey to measure the undercoverage, then we would have had to remove as much overcoverage as possible. And there are various strategies that other countries have used to do that. So option 3 would be, rather than needing to rely on a survey that needs to happen at some frequency, instead we use the complementary nature of different administrative data sources to patch up the holes in each other. And this is the example that the Ireland work and the PECADO paper is demonstrating. So they make comparisons to doing it in an option 2 kind of way, where a survey is used instead, and make comparisons to using that instead of the driver license data. So option 3 could look like that. It could look a little bit different. We could combine more lists in a larger scale model. But this is a kind of option where we're not formally using that survey to estimate something, but we may use it to audit and update and check how well our admin-based system is working. So in the option 1 case, this would look most like what Italy were doing just before the pandemic. So in Italy, you have people required to give their details to their municipalities and register, and there are registers held by those different local areas. And they run these surveys in this kind of permanent population housing. If we started to have to use rules like Italy have done, then that's already moving towards option 2 or 3. We'd just be using the survey to kind of top up. Oh dear, clicking isn't working there. Oh, there we go, okay. So option 2A, this is where we're able to assume that the undercoverage is negligible. So we would just run a survey for overcoverage. And Israel in 2008 were doing something like the option 1, and they were enumerating both or estimating both. And then since then, they've been able to move towards more of an option 2A, where they are estimating the overcoverage. And particularly, they have a good register, but they have lots of people in the wrong place. And it does include some people who don't live in Israel at the moment. So the questionnaire is mainly designed to capture those differences. We would need, if we wanted to do this, we would need an almost complete coverage of the population in the register that we would use. And we don't have a register. All we do is we link together data sets from different sources. So where we have something called a demographic index, which is like the spine that the SPD is derived from after filtering, that EPD might have enough coverage to achieve this, but we would really want to make use of more sources if possible to improve it. But the same problem as option 2A with the overcoverage. So option 2B is the other side of the equation. We would have removed as much overcoverage as possible by using the trimming methods that are described in the PECADO paper. And here, where we are just using a survey to estimate the undercoverage, we don't have that problem of needing to collect accurate data about people leaving the population. This isn't really used in practice by other countries at the moment, and we would need to do some extra research work to establish the best way to estimate these things. But it is very close to what we've been doing with the census, because the census has not had to really estimate the overcoverage in the way that we're talking about with administrative data. Okay, so on to option 3. In this case, we are trying to build a big system that uses all of the administrative data that's at our disposal. And it might use some surveys, but it would just be for some periodic auditing. It might be that we could just run a small sample size every year, or we would do a slightly larger collection exercise less frequently. This gives us a lot more flexibility potentially if we have some sort of inconsistency with some sources not being available sometimes. Again, there. Thank you. If there's a problem with some sort of supply, we might be able to form a system that is robust to that. So in the Ireland PECADO paper, we have a nice simple example of how this could be made to work well. They have managed to remove the overcoverage effectively by using a strict sign of life definition to be included in the person activity register, which is a kind of more exclusive version of our statistical population data set. And the other advantage that they have is a nice driver license data set, DLD, that has negligible overcoverage. And you really do need to be resident in Ireland in order to renew your driving license in that way. They also have the advantage of a good unique identifier to make it possible to link these sources together. At the moment, still running a census every 5 years and checking how well the admin-based method compares to that. But at the moment, it's not possible to do accurate placement. And so we have that challenge that would need to be overcome if we were going to use it for England and Wales, because that's one of the core requirements of the dynamic population model. We need to be able to break it down to those smaller areas. A slightly different perspective on how to do estimation with just administrative data only would be the examples of Latvia and Estonia. In the case of Latvia, they have trained a logistic regression model on census data to work out who might be more likely to be in the population and who's less likely. You can attach a weight to people and do a kind of fractional counting method, or you can threshold that number, choose to include everyone over a certain probability. Estonia has been working on a slightly more heuristic set of curated rules and observing what numbers that they get out at the end of it. That would be most close to what we're doing with our statistical population data set at the moment, and we're just trying to make that as close to the true population as possible. So one of the main issues with these established approaches is that they haven't been in place for a while, and they haven't had any systematic way of updating them and making sure that they are still accurate and relevant. We would need to put in place some kind of auditing and have a structure for how to check the quality in an ongoing way. We might be able to collect some data to update a logistic regression model using the kind of field work that we described with option 1, where you would be running a survey to enumerate those things. In a similar way, we could collect some examples that we can then feed into retrain a model for this one. So we have challenges for England and Wales if we want to put this into practice. We still have overcoverage in our population data sets, so we would need to test out using some stricter rules-based approaches. And we also want to explore the kind of approach that Latvia have taken. We've just had a recent census, so that provides us with lots of new data that we can explore for that. We would also need to work out how to structure this auditing survey, how to make it as efficient as possible. We have lots of existing work on how to optimally design a sample to estimate something directly, but we have no experience in what's the best way to make an audit survey effective and efficient. So there's work to be done there, and we also haven't got a good framework for assessing that quality. So there's collaboration with other countries, I think, will help here. Italy are slightly ahead of us, and I've already started thinking about how their auditing will work. We've got various different model options that we can try for that. So in summary, next steps for England and Wales. We recognise that option 1 and 2A are quite challenging because of this requirement to measure the overcoverage and collect examples of those types of individuals. And in the work that we've published today, we've done our best to essentially use those methods in option 1 to estimate the undercoverage and the overcoverage in the SPD for 2021 using the census coverage survey. And we found that, as we might expect, there are lots of people who were in the SPD that we couldn't remove in that estimation. And so we had numbers that were bigger than the mid-year estimates for that time. So we know that that won't work at the moment. We have different ways that we could try and fix that. Option 2B is our option for trying to remove that overcoverage from the data set before we start doing the estimation. And we think that's a realistic first thing to try. Option 3 is our preferred option in the longer term. So we want to work on getting as much administrative data together and securing other supplies and understanding those and their coverage well as well. Because if we need to remove more of the overcoverage from our main statistical population data set, we need to make sure that it still has enough coverage left to do the estimation with. The more we trim, the more uncertainty there will be in estimation. So we want to supplement that as much by getting as much admin data as possible into this estimation. There are other things that we could try which are further away, using those kind of data sets individually, try to understand the coverage of each of them. Feeding them individually into a dynamic population model is also an option if we're able to study their coverage separately. So if we can't overcome the overcoverage by removing those that we think are less likely to be in the usual resident definition, we'll have to pursue the kind of field work that's necessary to estimate the overcoverage properly. So that's roughly where we've got to in terms of our current thinking. It's still evolving as we speak to other countries and as we do more research ourselves, more simulation work to establish what are the kind of quality repercussions of taking one of these choices. So I want to say thank you to Paul and Lee Chen, who have supported us in this work and given us lots of useful advice, and the whole team at ONS and Katie and Owen, who are supporting the work. So thanks very much to everyone, and very happy to take any questions now.
Thank you. Should we give them a round of applause? So much. We have time.
So they collect data in municipalities. Then what? Do they report the data as is centrally, or do they do their own estimation and report that centrally?
My understanding is that all of the data is shared with the central statistics.
They've got somewhere to go to improve their collection then before they go anywhere further, because you can run a national system.
Well,
surely. Anyway.
I suppose I think outsourcing is partly solving the resource problem. If you kind of outsource it and sort of split up the problem and get them to, if it's going to affect them, the local area, the quality of their statistics, there's an incentive for them to do it well.
Is it prone to error? Can people register in places even for a short period?
Good question.
Yeah,
I'm not sure. Yeah, you're worth asking them. I'll write it down.
Any online questions? Anything in the chat?
Nothing yet.
If anyone online does want to ask a question, please.
There is one question.
There is one.
Yeah, there's one question. How is local under and over coverage dealt with? How do you select the correct address?
So in the work that we've been doing so far, we have been stratifying it at the local area by age, by sex, by hard to count level. So essentially, we're already down at the local authority level. And then we define our list A and our list B as the people who are on that list in that place. So in that place on that list. So that means if we've got someone who's in the wrong place on the SPD, and then the coverage survey said that they were somewhere else, then they count as over coverage in the place where the SPD had them, and they count as under coverage in the place where the CCS found them. And so we estimate both of those bits separately in the adjustment for the two places. Does that make sense?
I think Legion was just ahead of you.
Curious, in terms of time, how urgent is this? How quickly do you have to make these choices? Is it up towards 2020, 2030, or is it sometime before that we have to be clear on it? 2026 or something, talking about 2026?
Yeah, go on, Sarah, thanks.
Interesting you should ask, because we were just talking about that at the office a few days ago, and one of our reflections was that it's not as urgent as it was in previous decades. And the example that's always floated about now is that we stood up a COVID infection service in about 3 days. So yes, that was a blank check. So that made it easier to go faster. But it shows that with technology, you can make these decisions a lot later. So actually standing up the survey is probably easier than actually developing the methods, which is the problem that we are dealing with now, not least because it turns out that it's a lot harder to acquire the data that we need and manipulate it to the point that we, to the quality that we need. So the timeline's kind of a bit changed on both, but we'd like a decision in not the next spending, maybe the kind of main one that comes after, and still think that we can deliver the census in time if we need one. Yeah. It's a nice thing. It's nice to know that it's not as urgent as we used to think.
Sorry, kind of following up on a question that Sarah asked about people registering in two locations. So one of the types of overcoverage you didn't talk about was duplication.
Yeah.
And how that might be dealt with, because you might find them in the population, but they're there more than once.
Yes, so in the work that we've done so far that used the census coverage survey, there was a big linkage exercise between the census coverage survey and the administrative data. So if two matches were found in the administrative data for one record in the census coverage survey, that would be our way of estimating duplication at the moment. For the census, there was the whole census to census linkage to try and estimate that. And we could do that for the administrative data if we think there is some left. Really, the best way to monitor that and assess the quality is at the construction of the demographic index, where we've got metrics about, or we hope to have detailed metrics on how good is the false positive rate and false negative rate for constructing those clusters. And if we've accidentally kept clusters separate that should have been grouped, then we'll have that problem. We won't have that problem. Yeah, in Italy, they're not doing that at the whole nation level, maybe. So I don't know. I'll have to ask questions about whether that causes a problem with having registers in different places.
More questions from the floor? Any more online? Okay, let's thank Eleanor once more for a fantastic presentation. Change slides and change speakers. If anyone can't wait half an hour for coffee, now's a good time to do it, because this will take me a moment anyway. Otherwise, let's crack on. So it's fantastic to have John Dunn, the lead author on the paper, speak in this session as well, in the pre-meeting. And John, I'll let you say more, but the title is Official Identification Numbers in Irish Statistical and Public Administration Systems. So John Dunn at the Central Statistics Office Ireland will be presenting this part of the DeMO. Over to you, John.
Okay, good afternoon, everybody. Just for this talk, I just wanted to go back and kind of give a bit of context just with respect to identification numbers and how they've evolved in the public administration systems in Ireland, and also how we're using them in the Irish statistical system. I will start probably go back to the 70s when we had kind of a single number for social welfare and a single number for tax. And then I'll finish up with kind of a state of play where we are today. And then before I really finish, I'll kind of try and set up what the talk for the afternoon. But first, I want to start with where probably some of the key inspiration comes from for the development of the Irish statistical system and Irish administration systems, particularly over the last 10, 15 years. So, I mean, I think we all look to the Nordic statistical systems with a lot of envy, especially the register-based systems. But if we go back to the 60s, I think there are probably three key ideas that we can take from the way they set up. And one was kind of like a database style thinking about identification numbers. So the first one is identification numbers for statistical units and particularly for persons. The second one then was the concept of linking on those identification numbers. So you have the identification numbers, then you have the linkage on those identification numbers. And particularly that diagram on the far right, I think is a representation, I think in a paper by Lars Tigerson from the 80s. This has played a role in helping us influence and develop putting data reform at the heart of public sector reform in Ireland today. Keep coming up time and time again, and the same issues keep arising. So the issues covered there probably resonate quite well now when we're thinking about big data and privately held data and bringing all that data together. So, and it's also a good contrast to the Nordic model and how it has evolved. So I'm going to split the story into two. We talk about pre-financial crisis and post-financial crisis, because the pace of change definitely changed post-financial crisis. So going back, we kind of had the separate tax and social welfare numbers. They came together then in 1979. So we had one, what we called an RSI number, which was the basis for the PPSN number going forward. I think that's the same as the National Insurance number in the UK today. Our Statistics Act then came into being in 1993. This is quite a powerful piece of legislation, and it's also hasn't really changed much since 1993. And I have a feeling our Director General just went shopping across Europe and picked the best bits out from all the different pieces of statistical legislation, put them together. But at the heart of it was exploiting admin data for statistical purposes. And that's what we have as a key anchor piece of legislation. Freedom of information legislation, 1997. This is kind of where we all have to operate in an open and transparent way in order to provide trust as public servants. It's already there in the UN fundamental principles, but it's also across for public services. So 98, we have our PPSN come in, and today it's issued when a birth is registered. So if you want to qualify or you want to collect children's benefit for your child, you need to register your child, and that's when the PPSN is assigned. So there's a payment attached to it. Now there could be a lag from the birth, but in general, it gets in there pretty quick. 98 also saw data protection coming more to the fore. And then in the 2000s, we saw the PPSN coming onto other public administration systems on a voluntary basis. So you mightn't have had complete coverage, but public bodies were looking to use it in order for themselves to be more efficient and effective in how they delivered their services. In the 2000s then, we had, in Ireland, we never had a postcode really outside of Dublin, parts of Dublin. So it was like, go over the hill, go to ask for Mr. Murphy, across from the post office or whatever, and letter gets delivered, local knowledge posting. But there was a big discussion in the 2000s around whether we should adopt a container postcode system or we should go for a letterbox type postcode system. And that discussion kind of ploughed on a bit, and the privacy element came in and other elements came in, and there may have been vested interests. But ultimately, the letterbox did win out. So that was one that the CSO kind of influenced towards in the right. It wasn't the only stakeholder, but it was one of the stakeholders that were driving towards the letterbox. And that's proved invaluable now. So now, instead of me telling you, go over the hill, I can give you a 7-digit code. You can put it into Google Maps, and that will bring you right to my door. So you can think for deliveries and everything else. It's quite powerful. One we didn't win in the 2000s was there was a individual health identifier, or IHI. CSO again advocated that the PPSN should be used for that, but I think there's possibly a sense to protect privacy that you should be separating identification numbers for different sectors, maybe separate number for education, separate number coming from some countries around the world. And what we ended up with in 2014 was legislation which introduced a separate individual health identifier. However, it was seeded from the PPSN, but But I'll come back to that when we get to post-financial crisis again. We also reached out in the 2000s and started visiting government departments with a view to seeing what data, an inventory of their data holdings, seeing what data holdings they had with a view to see what we could use for statistical purposes. And then another key piece there, legislation 2005, was the Social Welfare Consolidation Act. And this brought together various pieces of legislation and gave the Department of Social Welfare overall control of the PPSN and how it's managed across all the public administration systems. So before I go on to the post-financial crisis side of things, I just want to tip into 3 pillar pieces of legislation for information governance in a modern democratic state. And these are quite important because they play a big role in negotiating access to data sources today. It's the right to privacy. It's there in the fundamental principles of statistics and in statistical legislation, but it's a hell of a lot stronger in the GDPR and the privacy legislation and what we're expected to achieve and how we're supposed to demonstrate how we're achieving that. Spoke about freedom of information legislation, but what we don't, I feel, argue for, or we don't sell strong enough, is the right to live in an informed society, and that's to have information and statistics about what's happening, how policy is happening, how programs are being run, and so forth. Quite often, statistics falls under a general statistics category in privacy legislation. And we probably need to do a little bit more to carve out the concept of official statistics and link it forward in people's minds to actually, it gives us evidence-based policy making and a much better society as a whole. So back to the story or the history. Ireland got hit particularly bad with the financial crisis in 2008. One of the signs you know something has gone wrong is when traffic to your website quadruples. You know there's a huge demand for information. Like when things are all going well, you don't have that much of a demand for information because you have money in your pocket, you're going out on a Saturday night or whatever. If you can't afford to go out or you can't afford to put food on the table, then you start looking for answers. The same with business and so forth. So in 2009, CSO set up the Administrative Data Centre. And this was really similar to the statistical archive idea. And the Administrative Data Centre had really 2 key functions. One was to act as a catalyst for development of the Irish statistical system and bringing just showcasing how data can be used to inform policy and just inform society. And the other one was to act as a clearinghouse for administrative data coming into CSO. So we kind of industrialized our collection and brought it together into one kind of nexus from all the different parts of the office as a whole. Then in 2011, our National Statistics Board put data at the heart of public sector reform using the concept of national data infrastructure. Okay, a national data infrastructure is really the key to national. Is just having really official identifiers for business, buildings, and people on all public administration systems. So it's back to the original idea to make the linking possible. And then subsequent to that, we had the rollout of Public Services Card in 2013, which strengthened authentication systems. PPSN was required for driver license. It was no longer voluntary, so coverage jumped from 40, 50% of applications now up to 95, 98%. We had the health identifiers. The Air Code eventually got launched in 2015 and is now starting to become universal in a lot of our admin systems. It's common with most people. The But again, when the pandemic hit in 2020, we were able to showcase and reuse our statistical infrastructure and the ADC to showcase kind of a fast response capability and allow CSO to play its role in the government response to the pandemic. And one of the things that did happen was in the vaccination rollout, which is a health system, the identifier used was not the health identifier, but it was actually the PPSN, because it was much easier to roll that out and to do it in a quick thing. So we're seeing a kind of a change there as well. So to think we didn't win the first battle, we kind of got there in the end with it. So which is kind of good. So just brief. Yes. So sorry. Yeah, you picked it up. So yeah. So we have in the letterbox database, we call it, which is called GeoDirectory. It's actually owned by the post office, and it's used then as licensed out. But it also has a building ID attached to the letterbox. So if you have multiple letterboxes on a building, so you'd have an apartment block, then if each of them have their own letterbox. We still can't get at different households behind one letterbox. So that's one of the challenges, but it's getting us, starting to get us a good bit of the way. So if I do a quick stock take of where we are and all that linkage, we always had a good relationship with the tax authorities, so our identifiers are quite good around business in terms of enterprise and enterprise groups. We do have a problem with local units. Property, we now have that letterbox database. Persons, we have PPSN kind of nearly universal across a lot of admin systems. We list these admin systems there. These are roughly a listing of the types of administrative data sources we have. From the cradle to the grave, you've kind of got births, children's benefit database, primary school, secondary school, higher education, further education, employee tax, self-employed, social welfare, drivers, some medical data. Roughly half the population receives some kind of medical benefit, whether it's through medications being paid for. In particular, those under a specific age and those over an age are entitled to free healthcare, and then it's being tested in between. And so pensions and deaths. So when we're setting up and thinking about population estimates, and we're thinking about signs of life on each of these systems, you kind of got, the original idea is you got to kind of think that you got the population covered on all of those systems. It's very hard. It's very hard for people not to engage in one of those systems in a given year. So this was our original idea. So you know, maybe just to think about now for the talk later on this afternoon, what cohorts maybe would be missing if we were to use a strict science of life, you know? So we'll hear more about that later on, but just to set it up. So that now will take us through to this afternoon's talk, setting that up like that. I don't think I have anything more to say other than to leave you with that cliffhanger and thank you. Yeah. Okay, thank you.
Thank you, John. Time for questions. If anyone's online wants to ask a question, please type it in the chat or raise your hand. We'll spot you, but we'll start in the room. Yeah, Eleanor.
Hi, thanks, John. We're really interested in this kind of postcode and how it's attached to left. So if you've got new build things, do they automatically get one assigned as soon as they go up? And is there any kind of error in that? And how much do you know about that process and what it works?
It's a good question. How it got rolled out in the first place was the people who got the license to operate it actually coded the addresses they could in the administrative systems for government departments. But we have a lot of non-unique addresses. So effectively the 60 or 70% of maybe urban addresses, no problem, kind of post-coding. The 30% of rural addresses, problems. So that's a kind of a legacy thing that's kind of happening over time as people update their details or engage with systems. They're now automatically asked for their error code in a lot of systems. But as to how the building gets in, we did have a lag from when a house was built and would have no error code to when it did get an error code. But we're starting to push back to try and get those error codes assigned. And when I say we, it's kind of a collective, not just the CSO, but kind of a collective in Ireland that are interested in housing, try and get it pushed back to the planning stage. You know, so the error code might get assigned either somewhere along the planning stage, maybe on an electricity connection stage, or possibly when there's the building is completed certificate stage. One of those key points would seem to be, whichever one probably comes up the easiest to implement will probably be it, or it makes the most common sense. But that kind of point in time, we're trying to find and push it back to. It's not perfect, but it goes a long way as it is at the moment. Yeah.
And also I'm wondering about building code. Does the building code, I mean, every physical building can mention there's a number, but many buildings, especially in this kind of dwellings and so on, we have the buildings subdivided into dwellings or sections for different purposes and so on. Does the number goes to the below building level, or is it so? Can you have sort of add a number so that every, let's say, you have 8 apartments, let's say, and every 8 apartment is actually physically just this apartment, also have a number in the part of the building number system, or is it like a, at sub level?
The original design is for delivering posts and parcels, so it's comes from kind of a letterbox. Mm-hmm. So if you have an apartment building, each of them having their own kind of letterbox, so they will each have this 7-digit number. That 7-digit number is partitioned in 2. The first 3 digits are kind of a routing key, and then the last 4 digits are just kind of random numbers. So there's no intelligence in the last 4 digits. In terms of the database itself, it will have, I think it's a 16-digit ID number for building. And then within that building, there's another 16-digit ID, which will give you the address point within the building. So there might only be one address point for each building, for most buildings, but for apartment blocks, you can have many address points within the building. Then that's the key within the database. And then the public-facing key is the error code for public use. Attached to each letterbox then is an XY coordinate, and then the small area geography, and there is some information, attribute information about the house type, whether it's a bungalow or whether it's detached or whether it's terraced, but the problem is that classification hasn't been consistently applied across the country. So
it's like the number is rich, number system is rich enough to capture the variable. It's like who is using it? When do you have to use this number apart from the people who are in charge of this list?
If I jump into a taxi tomorrow, taxi driver, instead of asking for an address, he's going to ask for the error code.
Yeah.
So the way it rolled out, the way it launched as well is they sent a fridge magnet with the error code on it to each house so that they could put it up in the fridge to try and get people to grips with it. It really, really caught on But caught on first in rural areas because that's where the big advantage was. But then the next stage where it really caught on was when it got licensed to Google and the sat nav people, because now all the delivery drivers use it. They use it to plan their routes and so forth. You know, so it's really opened up that whole process.
So that sounds like the poster that you have here, but the building code sounds a bit like the UPRN, the unique property reference number. But who uses that though?
So
They're connected. Are the two connected?
yeah, like the database behind the scenes has that building ID and letterbox ID and the XY coordinates. But attached then in the record is the air code attached to that. Okay. And it's the air code that's only just 7 digits and is user friendly that people use along with their address. You can also go look up somebody's address or put an address into a website and pull up the air code for it or on the website. They clearly make a distinction and say it's not personal data as well and argue, and they have made that argument since day one in 2015, 2016. Timing was probably critical in making that argument as well. At that time, now that the air code and its public good has been well established, that you know, it would be hard to roll back. You know.
So is it, if you're trying to, sorry,
No, go ahead.
if you're trying to send something to somebody, is it enough to put a name and an air code on it?
No,
No. Okay.
not with on post, because it is if you're using a parcel service or if you're using a private commercial delivery service. But even though on post own it, on post want the address because they use that local knowledge that's been built up over years and years with the postman, you know, to actually deliver the mail. The postman, when they're sorting down, they use the first 3 digits as part of the routing key on post or the postal service too. Their systems haven't been upgraded, as far as I know now, and I'm speaking from what I believe is happening. They still rely on the local knowledge of the postman, and they're slowly upgrading their systems to take advantage of the full 7 digits.
So this list of data sources looks pretty comprehensive for private households. Presumably, you've got the same challenges as we would do for reporting private household populations.
Okay, I just hold my hand up here and say I come from the administrative data side of official statistics, so I know very little. So any answer I give you will just be subjective, but yes, we do have challenges in trying to get into. But generally speaking, I think the sense I get from speaking with colleagues in Census is that people do want to partake and participate in the census and in surveys. The surveys are more difficult. The census is a different operation. So.
Be covered within the administration.
Yeah, I think our census operations do treat them as separate kind of problems to solve in their own right.
And does admin data treat them separately? So your student halls, are they really comprehensive? Or your prisons? You won't believe it, but we sometimes have problems enumerating people in the census in prisons and in the census. So are you confident that you've got really good coverage of people living in households and all those living in communal establishments, like student halls, like prisons, like care homes?
I don't know.
No, but in the admin data.
In the admin data, where do they show up? You know, you think about it. If they're receiving social welfare, will be there. We don't have any direct admin data source for prisons or halls of residence either, because I think most of the student accommodation in Ireland would be privately run, I'd guess.
Their address would just happen to be in that communal establishment, and you don't really mind it's a communal establishment or a residential home.
Yeah, I think geographical location is a problem we will struggle with, because if we look at the admin data sources, you could have a young male and you could have 3 or 4 different addresses and you won't know which one. So
just following up on this, it's really interesting. They're all things that people claim or do, and they're all static, if you like. There's no sources for when people are moving.
Yeah.
So, I don't know whether you have any like border type data that when someone goes on holiday, they have to give their PPSN, or they live in the country, or anything when people are moving addresses or anything like that. So, kind of administrative data sources that capture movement that will give you a PPSN that you could use in the system.
I think the problem with looking at rules might work for 60 or 70% of cases, but you'd never know where they are. And this is where I struggle with the kind of the rules idea for trying to, then you could probably identify some, but you probably need to bring in some kind of coverage survey or some kind of survey for calibration that Eleanor was speaking about. I think at the end of the day, we do need some kind of ground truth there. Like the driver license activity, because you have to give your address when you're renewing a license and show proof of that address or applying for a license, you know that people at that point in time, for a small cohort, you do have good information.
Your assumption is that your usual resident population will appear on that list somewhere.
If they're in the state, yeah.
If they're in the state.
Yeah.
That's your key assumption. So I was trying to think, well, okay, there might well be some people who are kind of outside of that system. What other things might pick them up? Then coming into the country before perhaps they use some of these services, or if they're moving around, you need to then.
I think we've quite good welfare systems as well for those that don't meet a certain threshold of income, that it encourages people to apply for PPSN. Immediately, it's better to be in the system than out of the system.
How does that? How in particular, think about foreign students, right? Students that come to Ireland to study, do they appear in the further education lists?
Yeah, they should appear in the higher education. Well, actually, the further education doesn't cover all further education, because there'll probably be a lot of private institutions in that it's only partial coverage. So that's probably one area possibly that we're.
But they would be entitled to be assigned a PPSN, and therefore.
Yeah, and typically they would be allowed to work a number of hours a week, so you would hope that they would show up then maybe as an employee.
Last question.
I just wanted to ask, the medical data is based on receipt of medical benefits, so prescriptions. So there's nothing to do with interaction with medical services. So if you go to a hospital, go to the GP.
No,
like that.
It's purely on the admin side where a payment has been made for whether it's an optical treatment or dental treatment or some, or whether you've kind of demonstrated that you're still in the state and have a medical card for receiving benefits.
I hate to interrupt the discussions, but we can keep these going in the half hour we have until the main meeting starts. Shall we thank John and Eleanor again for their presentation? I can check once more there weren't any more online questions. Okay, that's great. So we resume at 4 o'clock for the main meeting.